Is your baby all stuffed up? Here's how to use different types of nasal aspirators to help them breathe easier. We'll start with the bulb syringe. You always want to squeeze it first away from the baby's face and then stick it just inside his nose. Yeah. And then let it go, and that will suck out anything that's in that nair. This is the manual aspirator. You stick this end into the baby's nose, this goes in your mouth, and you suck out whatever is in the baby's nose. Don't worry, there's a filter to keep everything hygienic.
Oh, hey, I got something.
Lastly, we have an electric nasal aspirator. You stick the tip gently into the nose and let it do the work. Okay, ready? Here we go. Yay! Always start with the lowest setting first and hold the baby's head gently. If your baby has extra thick mucus that's not coming out, you can use an infant nasal spray. It's usually just normal saline. That helps to loosen up any mucus in the baby's nose.